Good evening and welcome to Information Please, your Peoria Public Library on the air. We're bringing you information about your library and your community. This evening my guest is Alice Jackson, and the two of us are going to explain to you what the libraries have to do with the Affordable Health Care Act. Hi, Alice.
Hi, Tricia.
Well, this is all new to us too, but
it is.
We probably have more information than a lot of people do. So today you and I will try and share that a little with our guests, and hope that this offers some assistance to people as we hope to be able to do that. Because I know a lot of people have already heard in the newspaper and seen on TV, well, libraries are going to help with this. So where did that come from?
And why and where? Yeah. Well,
where did that come
basically
from?
It all came out that at the American Library Association conference right around that time back in the summer, that the libraries will be here to help you with this. And we kind of all froze and thought, oh no, what do we do? But it's, we've calmed down. We've learned some things. We know what we need to do now. We're likening it to tax help, income tax help. We will provide the forms. We will provide assistance via volunteers when able, but we ourselves cannot fill out your forms and give you the advice as far as, which plan to go with or that type of thing. But we will try to provide all the information that we can. Someone, I think, said it best as saying that we will serve as a guide, but we cannot provide the legal information and that type of thing. We can just steer you in the information to find the information, but we can't.
We can't tell you what to do. We can't.
Exactly.
We can't be like if you go to a tax person and they actually fill out your taxes. Librarians can't do that.
No. Legally,
but why are we so perfect for this?
Well, we're the information providers.
That's right.
That's what our job is.
Well,
so
and we have computer labs.
Yes, we have labs that we can provide space and volunteers to help out with filling out the forms that need to be filled out. And we have the meeting rooms and we have the study rooms that you can have small one-on-one things with people to talk about these things, because it's private information.
Right.
So we have the space, we have the volunteers coming to us, and I mean, it's our job to provide information.
Level the playing field so everybody in the community can get the information the same way.
Exactly.
Yeah. Well, a lot of people may not even understand still. There's so many things flying around about the Affordable Health Care Act, and it's down to brass tacks. It's the law. Forget the opinions. This is what you must do.
You have to have insurance.
You have to have insurance.
Basically, we start open enrollment October 1st. This year, they're having a little extended time to get the enrollment done. Goes through March of next year. In subsequent years, it'll just be through the end of the year. It'll be in October through like a December 31st type enrollment period to make sure that you are covered and the people in your household are covered. But this year, to kind of get things moving, since people are just getting used to all of this, there will be the longer enrollment period, October 1st through the end of March.
And you can actually get covered starting January 1st if you get involved right now.
If you get yourself enrolled, your family enrolled, whatever it is, between the October 1st and the December 30th. No, I'm sorry, it's earlier in December, December 14th, I believe. If you get yourself enrolled in that time period, it will take effect January 1st.
Right.
But if it's after that mid-December date, as long as it's before March 31st, then there won't be any penalties associated with anything.
Which, of course, what are the penalties? I don't think people are aware that there actually is a penalty attached to this.
These will come tax time. If you don't have the insurance coverage for your family, for yourself, there will be penalties to be paid when you file your taxes.
And I understand that this first year won't be so bad, but the next year is really going to hurt.
Yes, it will increase. It's a lower rate for this first year to kind of ease you into it. But exactly, starting with the next year of tax filing, then it will increase a little bit.
Right. Well, so I kind of compare this to the rules of driving without car insurance.
Exactly.
You can't, and if you do, you're going to pay the penalty.
You're going to pay the penalty. It is.
The thing is, sometimes you can skate by without that one until you do something wrong. But the minute you file your taxes, it's going to show up that you don't have it.
It's all going to be tied together with that, and kind of hard to get out of that one.
So let's tell people October 1st comes, and who needs to do this?
anybody that does not have health insurance coverage either through parents, basically, so
children up to age 26 can be on their parents' insurance.
So anybody under that age that does not have any health coverage, whatever it needs, and through their parents, they need to enroll, check out, see what their options are. Not everyone has insurance through a job.
That's true.
If you are a veteran, you should be able to be covered through some of those programs, so you shouldn't have to worry about that as much. But if you do not have the option to have health coverage through your job, then you need to check this out and see if what you qualify for.
Right. And many people are going to be covered by Medicare at this point.
And that'll be a better option for a lot of people. That's something else that when there's a thing called the Marketplace application checklist, and you can go through and see.
We've got that right here. We can show folks and talk about it. What you'll do is when you come to the library, and there is a website. If you just come by yourself, you need to bring these things. If you come to, we already have 30 helping times workshops set both at Main Library and at Lincoln Branch, that there's actually trained people there from the health department that can help you go through step by step and fill these out. So there is somebody there to help.
Definitely. Heartland Health Clinic, there's several health clinics and health departments in the area that have received grant monies through either federal or state or a combination of things, and these people are trained.
And they're called, we've got navigators,
and then
in-person counselors,
counselors,
and certified application counselors.
Yes, there's lots of people.
Lots of people being trained. And I understand the only difference in what they do is whether the money came from the federal government or a state grant. And I don't know why they have to have different names.
Exactly. It's all the same training from what I understand, and it's all, they all do pretty much the same job to help you out, but it just depends on where the money came from.
And $39 million came to Illinois in the form of grants to help create the marketplace.
And to help people understand this better, and to be able to fill out these forms and to know exactly what you need to have to fill out these forms and to answer all these questions.
And when you go online, which you can do a paper form, but it's just like with taxes, they really, really push you to do it online because it's more secure.
It's more secure, it's faster, it's just all around an easier process. And that's what these people from Heartland will be there to help out with, filling out the forms. People kind of freeze sometimes when you say, oh, we want you to fill out this form on the internet. Oh gosh,
don't know how to do that.
Don't know how to do it, don't want to do that, don't trust it. That's what these people are trained to do, to come in and help everyone do that.
Well, and we have 1.88 million, sorry, too many eights, uninsured people in Illinois. But allegedly the effect is going to be when you bring all these people into the insurance base, it's going to lower everyone's rates.
That's
because you're going to bring a lot of healthy people in, and that will level things out.
It'll kind of level things out so you don't have as many.
That's one of those things that it's such a hot potato politically, but it's basically time will tell. And that is the theory behind this whole thing. But if people go, whether they do this at home, whether they come into the library and use a computer on their own, and it's supposed to take maybe an hour to an hour and a half, so we're looking at making arrangements if you're there on your own, not in one of the sessions, to let you stay on a public computer longer. I don't think we have that worked out yet.
No.
But
between our public computers and our computer labs, we should be able to have time, because it's not a short process. It is, at the minimum they set a 45-minute process for somebody that is very proficient on a computer and has all of their information right there in front of them
and knows what they're doing.
Exactly.
So but it's going to take longer if you're not.
If you're not real proficient and whatnot, then
and plus you're going to have to make important decisions about what health care plan to buy, so that's going to take a while.
We don't want people to have to rush to do that.
No, because then you're locked in for a year. But the other thing is we also have the free Wi-Fi, so you can bring your own device to the library and use our free Wi-Fi for as long as you want. If you're worried about using up your own internet plan at home, or you don't have internet at home, but you do have your own computer, you can do it that way too.
Come on into any of our locations,
But whenever you do that, this checklist is what you need. You need your Social Security numbers For everybody in the family.
Everybody. That's the thing. People generally don't carry around, or they don't think about carrying them around for their children. Well, make sure that you have
or
those
your
with
husband
you.
or wife,
Yes,
because
you actually need that information.
And I suspect we may have a lot of couples that come together to do this, to make the decision.
Yeah.
So you do need all those. And if you're a legal immigrant, illegal immigrants are not eligible for this. Legal immigrants who have documents, that they bring those document numbers. You also need employer and income information for every member of your household. And they say the best thing you can do is just bring your W-2 from last year.
Most recent W-2 is the best
Everybody's
thing.
W-2. It's not just your own. Everybody in the house that has a job, you need to bring those. And you can bring wage and tax statements, whatever, from your taxes.
Exactly.
And then we have some other things we need to bring.
Yeah.
Whoops, I went too far. You need the policy numbers for any current health insurance plans covering members of your household. And why do we care about that?
If you've already got insurance, there's no reason. Now, some people have said, oh, what if this is cheaper? Well, it's unlikely. It really is unlikely that you're going to find it. But
you also can get help.
You can.
If you are paying, it's beyond your income, there's a lot of help for paying for health insurance too, for people in very low income brackets. So that's the reason you'd want to do that.
Exactly.
Because you see exactly how much your insurance is costing.
Your percentages.
And there's a formula, and they figure out if you can get subsidized.
And
even if you're getting it through work, you may be able to be subsidized.
It may be the case where if you are paying an outrageous amount for your health insurance, if you make below a certain amount of money based on your family makeup and everything else, then it might be a good idea for you to apply for this and get your health insurance this way instead.
Yeah, get it subsidized.
And they don't want to penalize anybody. They don't want to pull all your money out of your paycheck. They just want to make sure that everybody's covered.
Yeah. So. And then the last thing you need is a completed employer coverage tool for every job-based plan you or someone in your household is eligible for. And you need to fill out this form even for coverage if you're eligible but you don't enroll.
Yes.
So that means if you have a plan at your job and you've chosen not to get it, you still are going to have to fill that out and bring it with you.
Yes.
So it is as complicated as taxes.
It is. It really is. But that's why we have, say, the Heartland Clinic that it's going to come and help. And they've scheduled, like you said, they've scheduled over 30-something times, I believe, to help both at our main library's computer lab and our Lincoln Branch computer lab. And they will have, it's an all-day thing. They're
there,
out the
and
lab.
You walk in
all first come,
with
first serve.
all your paperwork, and you're just going to help yourself a lot if you can bring all that paperwork with you.
Save a lot of time. And they will have not only the labs blocked out to use for that full day's worth of time, they also have another room scheduled just if you want to come in and ask some questions. Maybe you don't know for sure exactly what's going on. It's complicated. As we know, we've got all these notes, and we still have questions.
Yeah.
But they've got another room blocked out there that they can sit and talk with people one-on-one. They can just give some informational talks to people as they come in and say, well, do I need to do this or no? If it's an easy answer, then there you go. So they will have both of those. They'll have the lab, and then they'll also have another meeting room that they can use to talk to people.
Yeah, so these will be people that can really help you, but the main thing you have to remember is you can't put this off. I think health insurance is now like death and taxes. You can't avoid it.
No, you can't.
Everybody's required to have health insurance January 1st, 2014. It's the law, and there's not much time to do it in October, November, and part of December.
Yeah,
and then we're in
coming
trouble.
up. It's coming up.
It is coming up. It is coming up.
And we're also working with the Peoria Health Department as well as Heartland, and hoping to schedule some presentations and things like that. That if you don't want to come and fill out your forms there in the lab with Heartland on one of those days, maybe you just want to come and get information. We're going to set up some of those times as well.
Yeah, and I think people probably have questions about this marketplace thing. Where did this come from? Who's behind this? And I think what we found out is that in Illinois, some very responsible, big healthcare organizations got involved and formed Illinois' first not-for-profit healthcare organization, which is called, that would be this piece of paper.
Land of Lincoln Health.
Land of Lincoln Health, and it is a not-for-profit, which means nobody's making money off of it. All the funding goes back to cover insurance, and it may or may not be your best bet because there's also major insurers who have passed the checklist.
Yes.
I don't remember which ones. I remember Humana
I have a
was
few
one
of
them.
Blue Cross Blue Shield, Aetna, Land of Lincoln. I believe there's a couple others. I think there's 6
names
total.
we would all recognize
Yes.
that are also out there in the marketplace who have passed the test to offer insurance that you have the choice of getting that. But the Land of Lincoln Health has over 40 affordable health care plans available people could choose. And it's basically a co-op. I mean, we call it a not-for-profit, but it's a co-op. So everybody has an equal share in it, and it's, you know, pre-approved. There's a lot of different benefits. You can pick what you want. And the thing about Land of Lincoln is you can reserve a spot right now for an interview and to talk with them if you want.
Yeah, you can go onto their Land of Lincoln website and
Land of Lincoln Health
and reserve that spot, like you said, and get information, fill out your form, whatever you need to do, find out if this is the best route for you to go.
Yeah, so you can start thinking about it before we're all in a big hurry here with 1.88 million people in Illinois trying to scramble to get insurance.
All at one time,
And people might go, oh, they're all in Chicago, but that's not true.
No,
in the
it's
rural
not.
areas, so many people don't have insurance. And there's so many people who've had pre-existing conditions that now.
That's one thing that they really were talking a lot about it at the meeting that we attended, that you know, there's things like that cannot be held against you with the pre-existing, and there is the financial help if you need it with the, you know, I just can't afford that. Well, you know what, depending on your background, you can.
There's a subsidy calculator they will use to figure it out for you. But there was 4 messages that they want us to get out, and I'll let you go over those.
Well, all the insurance plans, they have to cover doctor visits, hospitalizations, maternity care, emergency room care, and prescriptions.
So even if you get a bare bone plan,
they have to cover
those things.
And everyone is always worried about going to the ER. You know, oh, I don't want to go, it's so expensive. Well, you know what? Here we go. This has to be covered. And then, of course, there's the financial help if you need it, if you qualify for it. And as we heard at the meeting, it is open to a lot more people than I thought it would be.
Yeah, the income levels are much higher than I thought they would be.
Yeah, especially like for a family. So check it out. You never know. All the insurance plans will have to show the costs and what is covered in simple language. I mean, they're legal documents. They're legal documents. They're hard to understand a lot of the time. That is not the case with these. They have to be written in plain English and easy to understand. None of that legal mumbo jumbo that people get worried about. They have to be all laid out there and easy to understand. So that's good. And show all the costs. No hidden fees for this or that, and make sure that you know what you're getting yourself into there.
Yeah, exactly.
And then, of course, the pre-existing condition thing. I believe the questions that they ask are you a smoker? And where do you live? Because those things always determine your rates. But other than that, they can't ask you, or they can, but it can't affect you, I guess, is the better way to put it. They can ask you these things, but it's not supposed to affect your rates. Yeah,
exactly. And I think smoking will be the big thing for a lot of people that will make their rates go up.
I agree.
I really, really do.
Unfortunately.
Let's see here. How can you pay?
Oh, well, there's several.
I've got a list
several ways. I know the one thing that stuck out in my mind when we talked about it was you cannot pay by cash.
No, you can't pay with cash. You've got the opportunity to use a credit card. You can use a debit card. You can write a check. You can pay with cashier's checks, with money orders, with prepaid debit cards, with electronic funds transfer from a bank account. That's like when you do your online bill pay. Or with automatic deduction from a credit or debit card is also available.
Right.
I don't know if some of those things may have an extra charge. When it says is available, almost sounds to me like they're going to charge you the extra
they're going to charge
$2.25 to do that.
Which may be the case, but they do stress, we will not take your cash. And when you enroll and everything else, you will need to have some of this information with you as far as your banking information, how you're going to pay for this, because there are some costs up front to get you started, of course.
Right.
So you have to kind of think of that and how you want to pay for this. And I know some people were concerned about the fact that you can't pay cash. Well,
well, you can go get a money order or a cashier's check or a prepaid debit card.
Yeah,
and
those
for
are
people,
available.
Yeah, people who prefer cash, and that sounds odd, but I know that some people are in such a tight budget that they worry about if they write a check that they'll make a mistake in their checking account, and so they'd rather have the cash in hand and give it to somebody. And I know I personally have started paying cash for a lot of stuff because I do not want them hanging on to my check forever, because they'll do that,
Yeah.
And some of the things that I ordinarily for my entire life paid in check, I now will take cash because I don't trust them what they do with your check. If you've given them cash and got a receipt, you're good.
There you go, you're done. Yeah.
So we've got this kind of the federal marketplace thing here that talks about, if we can review a little bit, and because you are going to have to create an account, another password.
Yeah.
Oh boy.
Yeah, and everybody hates that, but you have to. But that's what our navigators, the folks from Heartland and the folks that are at,
they're not going to want to know your password,
No.
but they'll help you.
They're there to help you with all of
figure that out, but you're going to have to remember it. And here's a little tip I learned recently is people go through all kinds of stuff with trying to remember passwords, but I read recently that the safest place to keep your password for something is actually written on a piece of paper in your wallet, because your wallet is the thing that you guard closely, that's always with you.
Yeah.
Because people can hack in and get electronic passwords, and if you're going to lose your password, I mean, I wouldn't write on there what it's for.
No.
But
if you're going to write it down.
Write it down and keep it with you. And we encourage you to do that with your library password too.
Yes, we do. Yes, we do.
But then the next step you're going to want to do is just
apply. Just fill out that application. And like we talked about here on the slide with the different things that you need to have with you, Social Security number, your W-2, of course, is one of the best things to have to show all that information. But make sure you have all that information for everyone.
Yeah,
everyone in your family.
Along with any insurance that you have or is available from your employer.
Right.
And if if you struggle to pay for your insurance, even if your employer has already sent you that letter, as we have gotten, saying, don't worry, your insurance coverage is going to continue, you're covered, and we've met the test for whatever. Still, if you struggle to pay for insurance, you may want to go through this process and see if you can get a subsidy.
Yes, because if you can, then you might be saving yourself a few dollars here or there, and they all add up.
Make your life a little easier. Yeah,
you have to do it. So
yeah. So then after you apply,
then you pick your plan, and we've talked about, like with Land of Lincoln and the 40+ options there. All the health insurance companies are going to have different options based on your lifestyle, the coverage that you need, that type of thing, where you live. So then it's just figuring out which one fits best with your family, with your individual person, whatever it may be. And again, the navigators and the counselors that are from Heartland and from Peoria Health Department, they're there to kind of guide you again.
Right. And then, of course, once you've picked a plan, you just go ahead and enroll.
And there you are.
And then you're a law-abiding citizen.
You are. Good job.
And you have health care coverage.
Yeah.
And so for people who, for many, many years, have had a pre-existing condition, then, your worries are over.
Yes.
You're now covered. And sometimes those things are just silly. It's something that goes back so far and you haven't had any trouble with, but they still have not done that. So, and I think we should stress too that the role of the library is to help you avoid sales pitches.
Yes.
There are going to be irresponsible people and just downright crooks out there trying to sell insurance to the unsuspecting. And I would say coming to the library where you're going to get unbiased.
Yes.
We don't care
Yes.
what you pick. Let me help you look at what you should be looking at.
That's exactly.
That's going to be, the library is going to be a safe place, or any place. There will be other agencies that are hosting these meetings from, you know, with the federal grants, with the navigators and all that. They're going to give you the unbiased advice. But
exactly.
you can be really sure that the library is not going to have anyone presenting any programs that are strictly there to sell.
To put it in plain terms, we don't have a horse in this race.
Yeah.
It doesn't matter to us. We want you all to be informed. We want you all to get signed up and be law-abiding citizens. But we honestly we
And
don't
have health care.
Yes, and have your health care. But honestly, it doesn't matter to us which health care
But
plan
more
you
importantly, we do what we always do, where we try to protect people and keep the information fair.
Exactly.
That's what, you know, there's some things we won't put out in the library because we can't present the other side.
Right.
We'll get people that ask us to put out a free magazine or something, and we'll say, well, no, because this is a very heavily weighted opinion and we don't have anything
the
people
opposite
can,
opinion.
we don't have anything that people can look at to see the other side, and that is exactly what we do, try to protect unbiased information, freedom of information, present all views, and make it easy for people
And
to
we'll
do
have
it.
all of this information available in paper form as well as through the website.
Yeah, on our
and
website, so you
lots
should
of-
be able to
yeah.
find gateways on our website pretty soon here.
Yeah,
To find what you need.
Yeah.
Well, Alice, thanks so much for coming and
Sure.
helping me share this information.
Yeah.
It's important. You and I have been very involved with the library from the minute we heard about this.
Yes.
So we are doing our best to get the information
We're
out
trying.
to people, and I hope our little TV show here has helped.
Yeah.
But for anything you need to know about the Affordable Health Care Act, you can go to peoriapubliclibrary.org. And you will find very shortly there under research, there's going to be a tab that will take you to all the important links, tell you the kinds of things you need to know. Our web calendar will have listed all of when those workshops are. You want to come to those workshops and be able to meet with a counselor and find out, you know, what you need to do and help guide you through that process. So we'll see you next week on Information Please.